Hi, this is Dr. Prasad, implantologist and prosthodontist, KIMS Hospital, both Secunderabad as well as Kondapur branch HOD. Today we are discussing about the type of teeth available to replace the lost teeth. Normally, whenever you lost your teeth, you should be replaced. Why we are going to replace means because 25% of the chewing efficiency will be reduced in the posterior area, that is the back area, and if you lost the teeth in the front area, aesthetically it is unpleasant. And the third one is whenever you don't have teeth, the upper teeth, the opposing teeth will migrate in that area, and the neighboring teeth also will migrate to that area, so the three teeth will spoil. Apart from that, when the neighboring teeth got migrated, there will be a gap between the migrated teeth as well as the natural teeth, where the food got impacted in that area and creates decay. So if you don't replace one teeth, the 5 teeth are going to suffer. To prevent that one, we should replace the teeth. What are all the types of replacements available? And replacing a teeth will restore all the functions. The types are removable and fixed. Removable, normally we used to give a removable partial dentures, where now we are discarding, we are not encouraging the patients, because whenever you try to remove the denture, it creates pressure on the neighboring teeth, where it becomes loose within a span of 1 year. So why spoiling the neighboring teeth? Instead of that, go for the fixed one. Fixed teeth, lot of different types are available. One is taking support of the neighboring teeth, and second one is taking support of the underlying bone. Taking support of the neighboring teeth is called crown and bridge process, where the neighboring teeth got shaped, and on top of that we will give the crowns linked with the last teeth crown also. This is called crown and bridge. And next one is taking support of the bone, where we can place an implant in that area and giving a crown, that is called as an implant. The available crowns for the fixed partial denture is, first one is metal crowns. Now we are not using the metal crowns because of this unpleasant appearance. And the second one is metal with ceramic crowns. Metal with ceramic crowns, the major advantage is it got a higher strength because metal, and outer is totally coated with ceramic, which got a very good aesthetic value. The only drawback with this one is it got chipped off. Whenever you hit the enamel, which is created on top layer, it got chipped off, and the metal structure will expose outside the mouth, which is unpleasant. That is the major drawback for this one. And the second thing is, in this also we have two types of this. One is lab made, and second one is digital image, which is DMLS crowns, and which has a very good accurate fit, so that it prevents entering the food or water into the crown, which in future, when the food and water enters, it creates a sensitivity and decay. And next one is all ceramic crown. It is purely ceramic, there is no metal, and it is very good in aesthetic value. It mimics with the natural teeth. No one can appreciate whether it is a natural teeth or a artificial teeth. Such a very good thing, but only drawback with the all ceramics is it got a lesser strength, so that we can't give all ceramics for the back teeth. Only front teeth we can give all ceramics. Next one is zirconia. Zirconia is a high strength ceramics, where we can use that one for the back teeth. And the next one is monolith zirconia. Monolith zirconia means totally it doesn't have any topping layer. Total mold is with zirconia. So it has a very good strength. And the only drawback with zirconia is the fracture, because it doesn't have any expansion. So next, these are all the things available in this one. Next is an implants. Implants means without taking support of neuron, taking support of the bone, and we are placing an implant inside, and we are creating that one. This is the latest technology, where everyone it has its lot of advantages except a few disadvantages, where all the patients are not suitable for this one. Most of the people are suitable, only a few uncontrolled diabetic patients, cancer patients, radiation patients, smokers, and oral prophylaxis who are not poor oral hygiene patients. So the implants we can do for all the patients. The major advantage of implant, without touching your neighboring teeth, maintaining the width and height of the bone, it maintains, it gives long life, and it restores all the function of the teeth which is lack when you miss the natural teeth. So better opt for an implant. My suggestion is opt for an implant. If not, then only opt for the other things.